Okay, so I'm here with Bill and we're just going to go through one of the preliminary exercises that we're going to start him off from week 1. Now, there has been a lot of research with patients just like Bill with prostate cancer and bone metastases and also in the pelvis, saying that resistance exercises are totally safe. Now, we need to keep in mind though that the prescription for exercise in cancer patients needs to be very individualised. Every patient is individual and we need to understand them holistically when we're going to prescribe. So Bill's 84, he's never done exercise before. So we're going to start him off. We need to think about strengthening the musculature in the lower limbs to enable him to ambulate as pain-free as possible, to enable to do his activities of daily living and remain as independent as he can for as long as he can. So, but considering the bone metastases are in his pelvis, we're going to do something that is going to eliminate any load through the pelvis to start with. And we're going to focus on increasing the strength of the musculature through the quadricep muscles. So the first exercise that we're going to have a look at is just a leg extension. And simply, Bill, I'd like you just to sit up straight in the chair, feel really supported. We're going to make sure that your hips are in 90 degrees flexion and your knees are, and that your feet are flat on the ground. So you can just watch me here for the moment, and then I'll get you to have a go and we'll have a look at it. So we're going to start out over the first 4 weeks. We'd like to increase the reps from 6 up to 12, but in the first week, it's just to see really how we go, and then we adjust as we go, as per Bill's needs. So all I want you to do, Bill, is one leg at a time, is just to, you can put your hands under here for support if you like, and just watching me for the moment, you just bring one leg up. Now, ideally, we want to lock that knee out and get maximum contraction through that the quadricep muscles, but you go as far as you can to start, and then we'll just build up as is appropriate. And again, anytime that you're feeling pain, fatigue, if it just doesn't feel right, you just say so and we'll rest, okay? There's no pressure. So all I'm going to get Bill to do is just to attempt 6 rises and leg extensions on the right hand side, and then 6 leg extensions on the left. And don't be concerned at all if on one side you can get further than the other, or if on one side you can do more repetitions than the other. It's totally fine. This is just to see where we're at, and then we can move from there. So I'm just going to ask Bill to repeat that now. So Bill, if I can get you just to sit up quite tall in the chair, use the back support as you can, and just you can see that the hips and knees are in 90 degree flexion. That's a really good place to start. Now Bill, if I can just get you to raise your right leg. Okay, awesome, and down. So we're going to keep it, we're going to take 2 seconds to go up and 2 seconds to go down. And again, that's going to reduce the force through the bones and the joints. Awesome. Just bring that foot, just be careful when you lift it out that you don't drop it further in front. Just make sure that you replace it back to the original spot each time. That's great. Now just try and keep your head in neutral, just so we keep our posture. Okay, now just on the left, let's see how far we can get. Okay. That's great. Thank you, Bill. Now as we progress, we'll start to increase the number of reps that we do through weeks 1 to 4, and if Bill's dealing with that really well, then in weeks 5 to 8, we're actually going to put some ankle weights on his feet. So it's actually going to increase the intensity through the quadricep muscles without placing extra pressure on the bones through the pelvis.